Have you ever taken a common pill without realizing it could raise your risk of dementia? The reality is more unsettling than you might think. Many seniors navigate a complex web of daily medications, often without hearing the full story about their subtle, long-term effects on the brain. We're not talking about obscure, rarely prescribed drugs. These are the pills millions of people, perhaps even you, reach for every single day to manage allergies, sleep, pain, or mood. If you or a loved one is over 60, this information is critically important. Understanding which pills to watch out for isn't just about avoiding medication. It's about actively protecting your memory, your independence, and your overall quality of life for years to come. In this comprehensive guide, we'll deeply explore 8 categories of pills that neurologists and geriatricians warn may elevate dementia risk in older adults. These aren't scare tactics, they are evidence-based facts, supported by a growing body of research and extensive clinical experience. You'll learn not just the names, but how these medications interfere with your brain's delicate chemistry, why doctors still prescribe them despite the known risks, and most importantly, what specific questions to ask and what safer alternatives you can discuss with your healthcare provider. Stay with me until the end, because we'll not only cover the hidden dangers, but also provide a clear, actionable plan for you to safeguard your cognitive health. This is about empowerment, not panic, arming you with knowledge to live smarter, longer, and with greater peace of mind. Let's get started. Number 1, anticholinergic medications. This category represents one of the most well-established pharmacological links to an increased risk of dementia. Anticholinergics work by blocking the action of acetylcholine, a fundamental neurotransmitter that is absolutely vital for memory, learning, concentration, and muscle function. They are astonishingly common, prescribed for a wide range of conditions including allergies as antihistamines, bladder control issues, overactive bladder medications, sleep disorders, stomach cramps, antispasmodics, and even symptoms of Parkinson's disease. The danger for seniors is twofold. First, the aging brain is naturally producing less acetylcholine, so further blocking it has a more pronounced effect. Second, the risk is cumulative. It's linked to the total anticholinergic burden, the combined effect of all such medications taken over months and years. This can slowly lead to brain fog, confusion, short-term memory problems, and difficulty with tasks that require focus. Consider Eleanor's story. Eleanor, a sharp 74-year-old from Ohio, was prescribed an antihistamine for seasonal allergies and an antispasmodic for irritable bowel syndrome. Both had strong anticholinergic properties. Over 2 years, she noticed an increasing struggle to recall names and often lost her train of thought, which she dismissed as just aging. It wasn't until a routine medication review with a proactive pharmacist that the connection was made. With her doctor's guidance, she switched to a newer, non-sedating antihistamine and a different gut medication. Within a few months, she reported a significant return of her mental clarity and focus. The lesson: a regular, comprehensive medication review with your doctor or pharmacist is essential, including all over-the-counter products. Number 2, over-the-counter OTC antihistamines. This is where many seniors are caught off guard. There's a pervasive assumption that if a medication is available without a prescription, it must be completely safe for regular use. This is a dangerous misconception. Many popular OTC allergy and nighttime cold/flu remedies contain first-generation antihistamines like diphenhydramine, found in Benadryl, or doxylamine, found in Unisom, and some NyQuil formulations. These are potent anticholinergics. For a younger person, the occasional use may only cause temporary drowsiness. But for an older adult whose body metabolizes drugs more slowly, the compound effect of regular use can be significant. The drug can build up in the system, quietly chipping away at cognitive reserves and accelerating cognitive decline. Consider Jack's story. Jack, a 70-year-old from Michigan, took a popular OTC nighttime cold medicine every winter for a decade to help with sinus congestion and sleep. He began experiencing senior moments, forgetting appointments, and struggling with complex tasks. During an annual checkup, his astute doctor asked for a list of everything he took, including seasonal OTCs. The link was made. Jack switched to a daytime, non-drowsy antihistamine for his allergies and used a simple saline spray for congestion. His alertness and memory noticeably improved. The takeaway: over-the-counter does not mean risk-free, especially for long-term or frequent use. Always check the active ingredients. Number 3. Prescription sleep aids and sedatives, benzodiazepines. Insomnia is a common complaint in later life, and drugs like benzodiazepines, e.g., diazepam/Valium, lorazepam/Ativan, temazepam, have been historically prescribed for it. They work by enhancing a calming neurotransmitter, GABA, which depresses overall central nervous system activity. While this effectively induces sleep, it also broadly suppresses brain function. The problem is that they are meant for short-term use, a few weeks. However, many seniors end up on them for years. Long-term use is strongly linked to tolerance, needing more for the same effect, dependence, and a significantly increased risk of confusion, memory loss, falls due to dizziness, and dementia. The sedated brain isn't engaging in the critical restorative processes that happen during healthy, natural sleep. Consider Henry's story. Henry, a 78-year-old retired accountant from New York, was prescribed a low-dose benzodiazepine after a stressful life event disrupted his sleep. At first, it worked wonders, but after 8 months, his daughter noticed he was becoming disoriented in familiar places and repetitious in conversation. His doctor explained the long-term risks and initiated a very slow, supervised tapering plan. Henry also began cognitive behavioral therapy for insomnia, CBTI, which taught him sustainable sleep hygiene techniques. As he reduced the medication, his mental fog lifted and his natural sleep cycle began to restore itself. The lesson: relying on sedatives for sleep is a short-term fix with long-term consequences. Explore non-drug therapies like CBTI first. Number 4. Non-benzodiazepine sleep medications, Z-drugs. When the risks of benzos became clearer, a newer class of drugs, the non-benzodiazepine sedative hypnotics, or Z-drugs, e.g., zolpidem/Ambien, Zalplon/Sonata, Esopiclone/Lunesta, were marketed as a safer alternative. While they are chemically different, they act on the same brain receptors and have similar effects. For older adults, the risks remain alarmingly high. They are notorious for causing complex sleep-related behaviors like sleepwalking, sleep eating, and next-day drowsiness. More pertinently, they impair short-term memory, reduce focus and coordination, increasing fall risk, and are associated with a higher incidence of dementia with prolonged use. The illusion of safety because they are newer can lead to a false sense of security. Consider Maria's story. Maria, a 73-year-old from California, took zolpidem nightly for 5 years. She believed it was the only way to get a full night's rest. While she slept, her family noticed her short-term memory was slipping. She'd forget entire conversations from the day before. Concerned, they accompanied her to a geriatrician. The doctor explained that the drug was likely fracturing her sleep architecture and causing amnesic effects. Maria was reluctant but agreed to a gradual taper combined with strict sleep hygiene, a consistent bedtime, no screens in the evening, and a cooler bedroom. The transition was challenging, but she ultimately began sleeping more soundly and woke up feeling genuinely refreshed and mentally sharper. The truth is, no prescription sleep pill is without significant risk for seniors. The goal should be to find the root cause of insomnia, not mask it. Number 5. Older generation antidepressants, tricyclics. Tricyclic antidepressants, TCAs like amitriptyline, nortriptyline, and doxepin, are less commonly used as first-line treatments for depression today, but they are still prescribed for other reasons: neuropathic pain, migraine prevention, and insomnia, often because they are inexpensive. The issue is their potent anticholinergic side effects. TCAs are among the strongest anticholinergic drugs still in common use. They can cause significant confusion, dry mouth, constipation, blurred vision, urinary retention, and serious cognitive slowdown. In older adults, these side effects can be mistaken for the onset of dementia, leading to a misdiagnosis and a potential cascade of unnecessary treatments. Consider Linda's story. Linda, a 69-year-old retired nurse from Colorado, was prescribed a low dose of amitriptyline for chronic tension headaches and to help her sleep. Over 2 years, she became increasingly forgetful and struggled with word-finding difficulty. She feared she had early Alzheimer's. A thorough neurocognitive workup found no signs of neurodegenerative disease. A medication review flagged the amitriptyline as the prime suspect. Her doctor switched her to a modern SSRI, selective serotonin reuptake inhibitor, for mood and a different, non-anticholinergic medication for headache prevention. Within months, Linda's cognitive abilities rebounded dramatically. The takeaway: if you are on an older antidepressant, ask your doctor if a newer, safer alternative is appropriate for your condition. Number 6. Certain anti-anxiety medications, benzodiazepines, revisited. It's worth highlighting this category again because the use of benzos for anxiety is so prevalent and problematic. Drugs like alprazolam, Xanax, clonazepam, Klonopin, and diazepam, Valium, are powerful central nervous system depressants prescribed for generalized anxiety and panic disorders. The same mechanism that calms anxiety also suppresses cognitive function. Long-term use can lead to emotional blunting, lack of motivation, and significant memory impairment. Older adults metabolize these drugs much more slowly, meaning the effects can linger for days, leading to a constant state of mild sedation that accelerates cognitive decline and dramatically increases the risk of dangerous falls. Consider George's story. George, a 76-year-old from Florida, had been on a daily benzodiazepine for anxiety since his late 50s. While it made him feel calmer, it also left him in a perpetual mental fog. He couldn't concentrate to read, forgot to pay bills, and had several minor falls. His new doctor insisted on a very slow, managed taper over several months, combined with referral to a therapist who taught him mindfulness-based stress reduction, MBSR, and breathing techniques. The withdrawal process was difficult, but on the other side, George reported not only reduced anxiety, but a return of mental sharpness he hadn't felt in decades. The lesson: anxiety is treatable with therapies that don't sacrifice your brain health. Number 7. Nighttime pain relievers with PM formulas. This is a major pitfall for unsuspecting seniors. Popular over-the-counter pain relievers like Advil PM or Tylenol PM are marketed for relieving pain and helping you sleep. The PM component is almost always diphenhydramine, the same potent anticholinergic antihistamine we discussed earlier. Seniors often take these for chronic pain conditions like arthritis, not realizing they are dosing themselves with a brain-altering chemical every single night. They are effectively trading pain relief for a gradual erosion of their cognitive function. The painkiller, ibuprofen or acetaminophen, may be necessary, but the added sedative is often not and carries disproportionate risk. Consider Joe's story. Joe, a 75-year-old from Indiana with arthritis, took a caplet of a PM pain reliever every night to ease his aches and help him sleep. His family noticed his memory was becoming unreliable. During a visit, his son-in-law, a physician assistant, looked at the bottle and immediately identified the problem. Joe's doctor recommended switching to the regular, non-PM version of the pain reliever during the day and implementing a new evening routine of gentle stretching and applying a topical pain cream. Joe's sleep was initially more restless, but with time, it improved naturally and his mental clarity returned. The hidden danger: the sedative ingredient in these combo pills is often unnecessary and harmful. Treat the pain and the sleep issue separately with safer methods. Number 8. Strong opioid pain medications. Opioids, e.g. oxycodone, hydrocodone, morphine, tramadol, are powerful painkillers necessary for managing acute, severe pain, like after surgery or a fracture. However, their use in chronic non-cancer pain is now highly controversial due to risks of addiction and, crucially for our discussion, cognitive decline. Opioids work by binding to receptors throughout the central nervous system, including the brain. This not only blocks pain signals, but also slows down everything else: breathing, digestion, and mental processing. They cause drowsiness, confusion, and significant memory impairment. Long-term use can lead to a syndrome often called opioid-induced hyperalgesia, where pain actually increases and lasting changes in brain structure and function, potentially accelerating cognitive decline. Consider Patricia's story. Patricia, a 71-year-old from Illinois, was prescribed opioids for chronic back pain. While they took the edge off the pain, she became a different person, lethargic, emotionally flat, and forgetful. She would lose her keys multiple times a day. A pain specialist conducted a full evaluation and determined that the opioids were causing more harm than good. Under close supervision, Patricia was slowly tapered off them. She was transitioned to a multimodal pain management plan, including physical therapy, a nerve pain medication, gabapentin, and occasional steroid injections. It was more work, but she regained her personality, her energy, and her sharp mind. The lesson: long-term opioid use is rarely the answer for chronic pain and comes at a tremendous cost to brain health. A comprehensive pain management plan is always superior. Final thoughts and your action plan. We've now taken an in-depth look at 8 types of medications that carry hidden risks for cognitive health. Anticholinergics, OTC antihistamines, benzodiazepine sleep aids and anti-anxiety drugs, Z drugs, tricyclic antidepressants, PM pain relievers, and opioids. Please remember the most important message. This is not about stopping any necessary treatment. Abruptly discontinuing some of these medications can be dangerous. This is about awareness, conversation, and proactive management. Your brain health action plan. Action plan 1. Create a complete medication list. Write down every single thing you take: prescription drugs, over-the-counter medicines, vitamins, supplements, and herbal remedies. Include dosages and how often you take them. Action plan 2. Schedule a medication review appointment. Make an appointment with your primary care doctor or pharmacist specifically to review this list. Ask them to assess your total anticholinergic burden. Action plan 3. Ask the right questions for each medication. Ask: is this absolutely necessary for my health? Does this medication have any effects on memory or cognition? Is there a safer alternative that is less likely to affect my brain? What is the plan to eventually taper off or discontinue this medication? Action plan 4. Explore non-drug therapies. Whether it's for sleep, pain, anxiety, or mood, ask for referrals. Cognitive behavioral therapy, CBT, for insomnia and anxiety, physical therapy for pain, and counseling for depression are highly effective and protect your brain. Action plan 5. Enlist an advocate. Bring a family member or friend to important doctor's appointments. They can help you ask questions, remember answers, and advocate for your cognitive health. Protecting your brain is one of the most empowering things you can do for your future. It's about making informed choices in partnership with your healthcare team. You deserve to live with clarity, independence, and confidence. If you found this deep dive valuable and want to empower others, please comment brain health below. Don't forget to like, share this video with anyone who needs to see it, and subscribe to Elderly Active Life for more content dedicated to living your best life at any age. Your support helps us keep creating resources to inform and inspire you. Thanks for watching, and we'll see you in the next video.